Okay, so I have my physician's order for my patient Drake Gray, and he was admitted 2 days ago with burn injuries. He was admitted for burns on his abdominal area, and my orders for him is that he has to change dressing once a day on the ABD pad, irrigate with normal saline packed with normal saline soaked 3-inch kerlix, 2 4x4s, cover with ABD pad, and secure with paper tape. So I've gathered all my supplies. I go into the patient's room and I make sure that the overbed table is clean, and I have my MAR with me. Hello sir, my name is Hongyang Lin and I am a student nurse. The reason I'm here is to do a complex wound care on your abdominal wound. So I check my MAR with wristband, Drake Gray, fin 1, 2, 3, 4, 5, 6, 7, 8, 9, fin 1, 2, 3, 4, 5, 6, 7, 8, 9. He's 36 years old. So he is unable to speak, but I had the order. It was either give 25 or 50 mcg of IV fentanyl for dressing change, and as according to the report, he had slept well, and so I will give the lower dose of fentanyl, 25 mcg, because it's safer and because he slept well. So I gathered my supplies, I perform hand hygiene, and the first thing I'm going to do is set up my sterile tray. I go top, left, right, and then blue forceps. And then what I'm going to get is I'm going to get my garbage bag.
So I'm just going to perform
and I'm going to get my sterile drape.
Introduce myself to them with my name and designation and just explain what I'm doing anyway, like in case they can't speak but they can hear me.
And the next thing I'm going to do is get my silver forceps to the side.
MAR for like any pure and pain meds, but if this was a patient that did,
the things I'm going to add is my 2x2s and 4x4s.
If they wanted it, but he doesn't have an order for it, so yeah. So I'm just gonna get all my stuff set up. So I'm gonna set up my sterile kit.
And I'm going to add in 4x4s.
So we have a trash bag. I'm just going to put it, I have one on the floor here, but I'm also going to put one here at the edge of the bed. Just for safety. And then I have an extra sterile area, which I don't really think I'm going to need, but I'm going to set it up probably right there, just for the sake of having it.
And I'm also going to add in my 20 gauge Cathlon and my 30 cc syringe. So here's my 20 gauge Cathlon. Followed by my 30 cc syringe. And then I'm also going to add in my roller kerlix and my sterile scissors. Here's my roller kerlix. And I'm going to add in my sterile scissors. And I'm also going to add in my cotton-tipped applicators.
Grab a couple pairs of these just because I don't know where I was going with it. Just trying to touch the whole, bring it away. The worst was that in reverse.
And now I wash my hands and I put on my clean gloves.
Already from when I repacked it, so everyone knows that I know what I'm doing.
And that is to remove the old dressing. Not yet. I forgot I need to add in my normal saline as well.
Also, I have it up here. It's in like an interesting bag. Like I'm not really sure how to open this since it's in a plastic bag. Like if it was a seal when
Now,
opening it, and then
I will wash my hands and put on my clean gloves.
it's pretty okay for that. I'm also gonna check my packing gauze in. Maybe grind it enough to make sure that it touches the inside of the.
And I'm gonna remove the old ABV pad. On the old ABV pad, there is a moderate amount of reddish serosanguinous drainage, and it has a small amount of odor to it. On the two old 4x4s, there is a moderate amount of reddish serosanguinous drainage, and it has a small amount of odor to it. And now I'm gonna get my blue forceps, and I'm gonna remove the old roller kerlix. On the old roller kerlix, there's a moderate amount of reddish serosanguinous drainage, and it has a small amount of odor to it. I wash my hands, and I'm going to put on my sterile gloves. So here is my sterile gloves.
And I think that's enough to apply. So then I'm just gonna take my saline and I'm gonna pour it into pour it into the large tube here. I'm gonna just quite a bit so that I can use it. There, so everything is.
Now my sterile gloves are on. I can touch things inside my tray. I'm going to get the 30 cc syringe, and I'm going to pull back at least 10 cc's of normal saline, and then I'm going to attach my IV cathlon. And I'm going to attach it on, and now I can irrigate my wound from the centermost deepest outwards, irrigating centermost deepest outwards in a zigzag motion, cleanest to dirtiest, until it runs clear.
And then just assess so the amount, the color, the drainage, any odor. So I don't know what
And then now I will throw this in the garbage, and I will now get my silver forceps and make
like you were saying. So I would say that the packing itself
4x4 dry rosettes, and that is going to be used to dry up
there's like a
the
quite a large
excess
amount of drainage,
inside.
serosanguinous drainage, and then this is completely saturated.
And I'm going to dab to dry one,
Drainage and a little bit to the abdominal padding. Probably I would still say moderate, like it's
discard of it,
less than 50.
and I'm gonna get another 4x4.
Yeah, so, and I would say that there's like no odor, no and then I'll just keep that in.
And I'm going to dab to dry again.
And then I'm just
And now it is dry, so now I will get 2x2s and make them wet in normal saline to wipe the peri-wound skin. So I'm gonna get my first 2x2,
I'll probably just put it here just so you can see me doing it, but measure the wound, like in terms of its strength, so I'm going to Q-tip. I don't want to touch,
and make it into a rosette, and I'm going to wet it,
put it on.
and then I'm going to use it to wipe the peri-wound skin
Here I'd say it's
top
about
to bottom
12 centimeters,
on the left side. Discard it, get another 2x2,
Really go to about here. Let's say that's about 8, so 13 by 8, and then for depth,
wet it in normal saline, and then I'm going to wipe the peri-wound top to bottom on the other side. Discard of it, and now I'm going to get dry 2x2s and dry the wound, peri-wound skin.
this other one sit here, just to check for undermining and tunneling. So
I'm gonna dry top to bottom, one swipe this way, discard of it,
about like,
and then I'm going to do the other side.
say that's probably a centimeter. But I'll put those to be too sure, it's about a centimeter, and then there's tunneling in about I'd say that's 8 o'clock.
And then I will discard of it.
Yeah.
And now
Then that
this accidentally touched the wound, so I will
is about like 5
discard of it. Now
undermining was just about like
it is dry, so
3 centimeters.
both of the sides are dry, and now I'll do my wound
Yeah, so
assessment.
I'll take note of that and document that.
But actually, it is still wet on some portions, so I will just use my sterile hands and I will wipe dry
And then I can start messing with
some of the excess because there's still wetness over here, so I'll wipe top to bottom, discard,
So I perform hand hygiene. I have a fresh pack of sterile gloves, so hopefully that doesn't bite me yet. This is a good pair of gloves.
and I'm going to wipe the wetness over here.
Just because I have the most room here.
And this is still sterile, and I discard. Now I can assess the wound. So everything is dry now. It looks to be about 20% eschar, 40% granulation, and 40% slot. And there's a small amount of odor and a small amount of bone exposed. I'll now measure the dimensions of it. The dimensions of the wound is it has a height of 10 centimeters. It has a width of 7 centimeters, and it has a depth of 4 centimeters. There is undermining at the 12 o'clock, and the undermining at the 12 o'clock has a height
Sterile.
of 3 centimeters. There is also tunneling at the 7 o'clock. The tunneling at the 7 o'clock
So
has a distance
draw up. Just for the log, I'm just gonna do 10, but like normally you would. Just to irrigate
of 5 centimeters. And there is eschar at the 5 o'clock with a height of 2 centimeters and a width of 2 centimeters. So I've noted all of that, and now what I will do is I will get my roller kerlix and I will soak it in normal saline,
And I would go from the cleanest part of the wound.
and then this is going to be a wet to moist packing, and then I'm going to wring out any excess normal saline,
And then I'm going to take
and then I'm going to get my cotton tip applicator and I'm going to use it to pack the wound.
and I have God, this one is but I just want to like dab one in without touching.
And I'm going to fill in all of the tunneling.
And then take it out, and then that would be the skin.
It has touched a little bit of the peri-wound skin, and I have noted that, and I would have gotten my buddy nurse to get me a new roller kerlix, but I'm going to keep going.
The excess normal saline is soaked up. Like that. I'm going to do one more just for...
And I'm going to make sure all part of the roller kerlix is in contact with the wound.
So then I'm going to clean the peri-wound. So I'm just going to do one swipe from top to bottom per side.
And I'm going to pack the undermining at 12 o'clock as well.
And then I'm just going to do one swipe. Like that. And then I'm going to take
And all of my roller kerlix is in contact
another one for the other side. Yes.
with the wound, and the last bit filled right here. And now I will discard of this, and I will get my sterile scissors and cut off the excess.
Just to dry it.
And then now I'll discard of this, and I'll attach on my 2 sterile 4x4s.
Do one one swipe just to dry it. And then on this side.
Sterile no touch tech.
And as I'm cleaning, I'm assessing the wound.
And I've noted this, but my hands were still sterile because I touched the top of this. Now my hands no longer need to be sterile because I'm going to apply my ABD pad.
There's a decent amount of S-bar. I would say that's about like the ratio when I would
So using sterile no touch technique.
probably about like
And now I will put on my
70%
paper tape
tissue and
in order to secure it.
end of this slap, and then there's a slight amount of S-bar on the outside. Again, just assessing for signs of healing and then noting any odors or anything like that coming from the wound as well.
Thank you, Mr. Gray. I will do my exit safety check and chart that I did this on the wound care flow sheet as well as the IPN.
So I have